everybody. It is Saturday, June 1st, 2019, and I'm Yazin Serrano reporting to you from the CCN Newsroom. Today's topic consists of an article written by Dr. Shirley J. Semple, Igor Grant, and Thomas Patterson called Utilization of Drug Treatment Programs by Methamphetamine Users, the Role of Social Stigma. In this article, in which I'll review today, social stigma is defined as the really extreme disapproval and discrediting of an individual by society. Social stigma is then proposed into three main components in its process. The first dimension of stigma is having culturally induced expectations of rejections. This meaning that people experiencing this have an internal disturbance of whether or not they will be devalued, rejected, or perceived as less worthy by being identified with a particular characteristic. In this case, it'd be drug use. The second dimension of stigma is actually facing experiences of rejection from individuals around you. Cases like this include drug users being rejected or discriminated in a workplace, rejection in the form of housing, and dismissal of legitimate requests for services in psychiatric hospitals. The third dimension is described as stigma coping strategies, which are the actions that these individuals do in order to minimize effects of stigma. Majority of drug users manage these types of stigma by practicing selective disclosure or seeking social support from those that can relate. In this article, researchers suggest a relationship between drug use stigma and participation in various drug treatment programs. There were 292 eligible participants who completed this experiment. They were recruited by family members, friends, or other participants enrolled. 47% of these participants agreed that they enrolled because of posters they saw throughout the city. This specific research sample took place in the San Diego County. The overall baseline assessment was for the participants to complete 4 90-minute counseling sessions per week. Within these 90-minute sessions, the participants were asked multiple questions. The observers then wanted to know answers to questions like whether or not the participant had ever been in a treatment for their drug use before. The 90-minute sessions also made sure to include information on meth use and its effect on unsafe sex, safer sex practices, and social supporters. Observers also wanted information on how many times the participant did meth in a typical day, and how many days the participant did meth within the span of 30 days. Participants were also asked their opinion on whether or not they believed they had ever been treated differently because of their drug use and people finding out about it. After being asked their opinion, the participant would then share a specific experience in his or her life when they were shown any form of rejection or major life event changes because of meth use. Loss of friends and even family members were mentioned throughout these sessions. Using stigma coping strategies, these individuals take in order to replace these effects of social stigma. Social stigma causes for drug users to be viewed as unpleasant and difficult as patients and everyday people. These false labels on drug users creates low self-esteem, can disrupt social and occupational functioning for people who may be trying to get treated. Majority participants agree that most people who have never had a drug problem tend to hold negative stereotypes of meth users, and it did not differ no matter which gender, education, ethnicity, employment status, income, or living arrangement a person might be involved in. In this article written by Drs. Semple, Grant, and Patterson, data is collected and results show that 69% of the sample stated that family members do act differently towards them because they use meth, and 56% said they lost friends because they found out about their meth use. 58% also reported that they have at some point been mistreated by others because they are meth users. All the research contributed throughout this sample suggests that there is a relationship between drug use stigma and the participation in drug treatment programs. The only question that can be asked is whether or not you believe social stigma affects the utilization of drug treatment programs. I'm Yazin Serrano, reporting to you from the CCN Student Newsroom.
All right, so good afternoon. My name is Megan Mahone. We're here today live at Phoenix Rising Wellness Center. Sitting across from me is Pedro Burnaby, who is not only the CEO but also the president of the Phoenix Rising Wellness Center. And today we're going to ask him to define stigma.
What I think is stigma usually take more like a negative stereotype. So when depending on what you're talking about, it could be race, addiction, it could be you name it, you know. But I think what we're here to talk about is methamphetamine, correct?
Yes.
Okay.
Okay, so my first question for you, Pedro, is do you think the drug use stigma may be a barrier to seeking treatment among meth users?
Yes, for different reasons. When we think about meth user or any addiction itself, we have a negative connotation as far as what a drug addict or a meth addict would be. Some people tend to imagine people in the streets, maybe homeless, using. What they don't realize is that many of the times, are people in working, you know, having a wife, kids, and some people even having, being wealthy or middle class. So that's why when they have a problem like this, they tend to like stay away from places like ours and not get any help because they don't want to be associated with that negative thoughts of a meth addict.
Perfect. How have you tried to change the stigma of addiction?
Well, here with Phoenix Rising Wellness Center, we are affiliated with, or in the efforts in Indian River County as far as educating the public, helping in whatever we can. We are part of SAFER, which is Substance Abuse Free Indian River Coalition, which is a group of law enforcement and other healthcare agencies in the county trying to educate parents as well as students and other members in the community as far about what it is an addiction as a disease rather than maybe a choice, and that sometimes putting a negative stigma on something like that will not let the people seek the help that they need.
Perfect. Well, thank you very much today,
Thank you.
Pedro, for your
No
time.
problem.
Thank you.
Guys, my name is Maritza Guerrero and I'm reporting to you live from the CCN newsroom, and I have some breaking news. We just came across another article regarding stigma on drug users. According to the article, The Stigmatization of Problem Drug Users, a narrative review written by Charlie Lloyd, stigma as of recently has been applied to prejudicial and discriminatory treatment of minority groups such as drug addicts or the mentally ill. Drug users are seen as more of a threat than people with an actual mental illness. Health professionals even see them in a different light, which harms the drug users more than anything. This causes drug users to delay or completely avoid visiting hospitals for any serious needs. The negative attitudes towards drug addicts stems from a subgroup that presents challenging behavior, causing them to get stereotyped. When asked, drug users said they felt rejected and stigmatized around non-drug users. This causes them to lose self-esteem and confidence, which is a very important factor in recovery. It gets to the point where drug users don't even want to interact with non-drug users and be stigmatized. Drug users can also stigmatize others to make them feel better about themselves and think about other people's problems rather than their own. Drug users don't only suffer from addiction, but also suffer from social, economic, and health problems. For the rehabilitation, users need access to employment, psychiatric services, and education to combat their problems. Drug users are undeniably a group that is highly stigmatized. Being a drug user seems to make you have trouble with interacting with almost anybody. This fear of a drug user comes from the fear of drugs and their effects and the stereotype of drug users. The more the individual are seen as danger, the more they blame themselves for coming to this position, and the greater they will be stigmatized. If the stigmatization of drug users ever go down, we would also have to fix the fear that comes affiliated with interacting with one. As they get stigmatized less, the more likely they would go to the treatment centers and get cured from their addiction, helping them to have confidence and make their lives better. This was Maritza Guerrero reporting to you live from the CCN newsroom, and now we're moving on to Megan, who has a special interview.
Okay, so I'm here today with Lynn Pearl, who's a certified addiction professional and primary therapist at the St. Lucie County Jail drug dorm. So Lynn, my first question for you today is define stigma.
To me, a stigma is something that is a negative view or even a shameful view of a particular subject that's created by society.
Okay. My next question is, do you think the drug use stigma may be a barrier to seeking treatment among meth users?
I think any stigma with drug addiction is a barrier to seek treatment, regardless of whether it's meth or opiates or alcohol. There is a stigma attached to all of it.
Okay, and then my last question for you is, how have you tried to change the stigma of addiction?
When I work with clients, the biggest thing is it's not even that important for me that society doesn't see it as a stigma. It's the person that has the actual problem that needs to not see it as a stigma. I've done a lot of work with people over the years, and the other piece of that is I've done a lot of education and prevention in Indian River County so that people can have more information about addiction and that it's not a personal moral weakness.
Okay, anything else you'd like to add?
I don't think so.
All right, thank you.